Welcome to At Home with Kelly and Tiffany, where naturally minded women gather together as we pursue simplicity and confidence in health alternatives so we can show up better in our busy lives and feel more at home in our bodies. Join your favorite home birth midwife duo for conversation, candor, and community.
You're at home with Kelly and Tiffany, and I'm Tiffany.
And I'm Kelly.
And these are peaceful times, peaceful podcasting.
These are the days of our life.
I have struggled with mood swings today. I'm like, the pirate ship ride at the theme park.
Yes.
Starts out kind of like, ooh, and then at the end, if you're sitting on the end, you're like, this is fun.
I'm sorry.
I'm on the coming down part where everyone's glad that the ride is almost over.
I appreciate that this is our first interaction of the day then.
I told you you'd regret spending time with me.
But I won't, because we're on the fun part of the ride now.
That's an excellent point.
Yeah.
And I'm going to be nice to you for the things that go out on the internet.
That's nice. Behind the scenes, no. That's great. What's going on with you?
I do not know.
Oh. Where are you at in your cycle?
Day 3.
Okay.
Cycle day 3.
It's usually not like that for you.
No,
from what I have gathered.
I think this is circumstantial.
I
think this is multiple instances in my day where things did not go the way that I wanted, and I ran out of coping skills.
Used them all up. Now there's nothing left.
There's nothing left. But I do want to talk about informed consent.
Of course you do.
That will fill up my cup real quick.
Actually, it absolutely will. And that's what we get to talk about today, using informed consent in all spaces of your life, but in particular for something that we hear from a lot of women they get zero informed consent about, which is pap smears.
It is one of the crazies of our career.
I can't tell you how many women we have seen who have never been explained what actually goes in their vagina, what happens during a pap, what the pap is even checking for, as we talk about it before we do anything and explain the procedure. They have no idea they've never heard. They don't really know why they're doing what they're doing.
You're crazy.
It's wild.
It's so wild. Before we get started, though, we have a huge win to celebrate.
Yes.
Which is last night we closed the cart to our new membership program.
Closed it up. But if you are not one of those happy people who got in on the membership, there is a wait list for the next time we do open those doors. And we're excited to dive in with this group of people and continue just, molding this into the best little membership community it can be.
Yeah, I was actually kind of blown away by how well it was received.
Yeah.
Which makes me feel even more excited.
For sure.
Because when you start telling women what they told you that they want, but you're like, no, listen, this is what you said, so I want to help.
I'm giving you the thing that you said you wanted.
But then they're like, no, actually, that's exactly it. And that's just extremely encouraging.
Yeah, it feels professionally and personally satisfying. Great.
So good. And thanks, lady, for your support in that. It's always nerve-wracking to do a new thing and to produce a brand new little baby.
Oh.
Little service baby. Throw that out into the world.
Yeah, for sure. And it's always, you guys are always such great, hype girls. We appreciate it so much.
Yeah, absolutely. But before we jump into all the good pap stuff,
yes,
I have a Chronicles of Vagina.
There really should be a theme song this little segment. I don't really know, but I'm dancing and I want to hear about your vagina.
That is not going to be the theme song to Chronicles of Vagina. No, it needs to be something like mystical and like a flute.
It sounds like a little Zelda-ish.
Yes.
Yeah. Okay, great. The ocarina or whatever they call it.
Yes. That is the vibe you're going for here.
Great.
Okay. So the story that I'm about to share, I did consider people who might accidentally hear it, and I'm still moving forward. I just want everyone to know.
This is saying something.
And so this is a story I may have told in this space before. This happened to me many, many, many years ago, but it almost happened again yesterday, which is how I have come to being reminded that this is one of the greatest chronicles of vagina stories that exist. So if you're hearing this for the second time, I am so very sorry, but
it's going to be a winner, I'm sure. I'm trying to think of what it is, so
you'll recognize it as I get going. I'm on my period, so it's period related. And anyone out there who uses a menstrual cup, there's a spectrum of ease that comes along with it. And sometimes the ease is overestimated, and you're just like, no, I put the cup in, I'm good. But then every once in a while, there's a mishap with the cup where you really start to question, is this the easiest, most sustainable, right thing for me?
Yes, absolutely. We've all been there.
Yes, so this is one of those stories. I think it was 10 years ago when I first started using the menstrual cup. It was right after my youngest was born. And it's a learning curve while you're figuring it out, right? But once you figure it out and you have it locked in, and it actually is collecting your blood, and you're changing it like once or twice a day, there's so much freedom in time management for your period once you can get it working. Because once you're starting to figure out, no matter where you're at in your body literacy, getting it in the right place, and troubleshooting leaks and stuff like that, like that's not for the faint of heart. Like that's the messy, really committed period of time, right? So you're so excited when you figure it out, and you want to start telling people so that they also know the joys of moving through the challenges. Okay. At the time that I was very excited about this, I don't know exactly how we got into this conversation, but I was friends with the woman who is now married to my brother, and they weren't quite dating yet. And it was in a ministry setting that we ended up in the bathroom together. And she was asking me about something that I probably started the conversation. I probably was already oversharing about something that was going on. And I think she was just pretending to be really interested in it, but I was going with it. And I said, well, I have it in right now and I have to change it. Let me just show you. And then you don't have to have questions anymore. Then you can just know how it works. It's actually really simple. And at the time when she said yes, I thought, oh, you're really excited about this. And I'm going to provide this wonderful educational opportunity to you. And I'm already in midwifery school at this time, so my vagina is a learning tool for others, right? I don't feel very modest. I feel like this is just very practical, anatomical. Come into the large stall with me and watch me change my Diva cup in the most educational possible way. And so I think she's actually just completely terrified to say no thank you at this point, that she goes along with it. I'll have to ask her sometime, were you actually truly interested? Anyway, so I'm sitting on a public toilet and someone is watching me, and I just finished saying this is the greatest thing ever. And I pull the Diva cup out and I empty it, and it slips out of my hand and falls into the toilet. And there's a handful of times in my whole life where something really dramatic has happened and I can't respond and pull it together immediately. And this was one of those times where I was just like, how do I come back from this? Well, I think I said, well, that's not supposed to happen. Let's pretend that didn't happen. And the thing is that I had to pull it together and just make it seem like it wasn't a big deal. But now my menstrual cup was in the toilet. So I had to get my menstrual cup out of the toilet. I had to figure out what I was going to do with my menstrual cup now, because you can't put it back in your body after it's been in a public toilet, probably. And then now I have to also figure out how I'm going to manage my period flow for the rest of the time that I'm out of the house, because I'm so confident in my alternative menstrual solution that I don't have backup, and repair this relationship with this poor girl who really didn't ask for any of this.
That escalated very quickly.
Oh my gosh. So yesterday I took our kids to the trampoline park while you finished up clinic visit at our office. I know. And I was sitting there minding my own business, getting some work done while they're jumping around. There's like 7 million people in there because it's a rainy day. Smart move. So I'm just trying to ignore everything so I can get a little bit of work done. And there's a feeling that happens. There's a sensation at your labia when you realize that your cup is about to give way. And I just had that feeling where I was like, oh, I got to go change this right now before something bad happened. So I went into the bathroom, and I'm just going as quickly as I can because I didn't tell the kids that I was going to be missing from the spot or whatever. And I pulled the cup out, I emptied it, and it almost slipped out of my hand, but I caught it. It was like spider reflexes. It was like almost dropping, catching very quickly. And I was immediately flash back to the 10-year ago dropping cup in public toilet.
That will be seared in your memory and mine as well.
Yeah,
I'm proud of you that you caught it.
Thank you.
Yesterday. Not the 10 years ago, Tiffany, but you've learned, you've grown, and it probably was a little bit of slow motion happening where you're like, no.
You only make that mistake once, ladies.
Yeah, you do. That is good. I would love to hear your sister-in-law's perspective on this experience.
Yeah, I mean, I've always thought of the story as like I was just really providing an educational experience, but as I've unpacked it over the past 24 hours, I realized that I think I bullied her into having to experience that with me. And I'm sorry.
You know, that's really like introspective, and I'm seeing a lot of emotional growth.
All right. Well, that's all I have to share today.
That was a great chronicle.
I'm going to go home and keep working that out. Can you just take the rest of the episode along here?
Yeah, for sure. Goodbye, Tiff. Good luck processing all of that. But we can move on from that. We can take that experience and make ourselves stronger, move forward.
What do these two things have in common? The cervix.
Here we go.
Okay, so you so gingerly and gracefully described the GBS swab a few episodes ago.
Yes.
Would you give us the same courtesy to give a description of what the pap smear procedure is like?
Yes, but can I use the correct terminology for what actually goes into your cervix? Whenever I explain it to people as I'm, showing them, they're like, that's the worst word that could be, used for that. And I'm like, yeah,
sorry.
It is. So great. You'll get the pleasure of that. So we can set the mood, actually, which I love to do. Our new office does not, the fluorescent lights don't turn off unless you turn it off in the entire, other people's offices also. So I used to set the mood and, turn those lights down and just have a little spotlight on your little vulva there. But set the mood, right? And you're just like, oh, I'm so calm, and I'm just thinking about what else could happen inside of my vagina today. And this is one of the many things that could potentially find their way into your vagina, depending on what you're up to today. But first things first, we take this long, hard speculum and place a little bit of lubrication on it, just, for enjoyment, comfort. And that little eager speculum finds its way towards your vulva, excited about what it may find as it enters into your vagina, slowly making its way in the dark. As it makes its way, it's getting wider, deeper, really searching for its soulmate at the end of the vaginal canal. And what do we see? As it opens wide, the cervix falls right into place with her favorite friend, the speculum. And then as it's open and we're just staring and watching this beautiful experience take place, then comes our little buddy, the cervical broom, not here to do housekeeping and sweep out cobwebs, but to come in and gently caress the cervix, pulling some wonderful happy cells from that little beautiful little guy in there, just cleaning up everything, right? Just taking a little bit of cell, doing its little broomy job. And then as quickly as it was in, it's out. And the speculum says, "Oh, cervix, this was a wonderful time, but I gotta go." And he slowly makes his way out of the vagina and scene.
I think this is the episode that we lose a massive amount of listeners.
Have you ever had a pap like
I never in my wildest dreams would I have described it that way. Oh, that was refreshing.
Anytime.
Wow, Kelly.
I will say I didn't know I was going to do that. And I feel like I've found some kind of useless skill of mine.
You have an ability to make something that could be really straightforward and clinical.
That's actually what I love about what we do. Like, yes, we get to talk about the clinical stuff, but I'm like, can we please just laugh? And like, this is kind of ridiculous also.
Yeah. Some women don't want to laugh about the PAP, and we won't laugh at you. If you want to laugh about it with us,
yeah,
we'll join in.
Absolutely.
I mean, awkward situations can really call for some humor.
Yes.
If you're that kind of girl.
It's true. Somebody once said that they felt like I was there doing a pap for her, and we were making a joke back and forth, and she was like, oh, she said something about like, maybe Tiffany should have been here or something, because like she's the more serious one. And I was like, that's funny. Like, that's not my experience.
She thinks I'm the more serious one?
Yeah, which I was like, that's just funny to me.
And she wanted me there.
Apparently.
She would have
I was like, you're the one making the jokes. I'm just egging you on here.
That's great. That's so great. Oh, man. Yeah, we have a lot of pap smear stories.
Oh, yes, we do.
So very many. You just cannot imagine the depth of creativity that walks into the clinic there.
That is true.
Stories for a different day, though. Let's talk about, thank you for describing the PAP.
Anytime.
We're going to really dive into details later. So if you're feeling extremely lost into how you have managed to get this far through the episode,
good work.
We have got it. Don't worry, it's coming. Informed consent is a really big piece of all medical care, all types of clinical experiences. Women rarely utilize it in a PAP situation. I think the reason is because women don't understand exactly what they're getting. They figure that it's just basically mandatory and kind of required if you want to be responsible with your health. And that there's not a whole lot of options besides just endure it and try to get it over with as quickly as possible, or don't think about it and avoid scheduling it because it's too horrific to try to work through.
Yeah, absolutely. And some of that comes from like a lack of education, and some of it comes from really terrible experiences that people have had as well. So some of it's like just, I don't want to say mate, but just like you create a story in your mind, and then some of it is like actual really poor treatment, which obviously this is like a very consent heavy, I mean, every area of your body is, but anything that is happening inside of your vagina, you every single time get to be in charge of that.
That's exactly right. And that is the theme of this episode, but especially of midwifery care in general. And we use the BRAIN acronym quite a bit when we're trying to lead women in making informed decisions. And it really goes across the board on so many things. Planning for birth, making decisions about pediatric options once your baby's born, obviously well woman care, anything at all. I mean, I use I use this system when I'm just trying to like sort out an educational opportunity for my child or something, right?
Yeah, for sure.
And so the BRAIN acronym stands for benefits, risks, alternatives, intuition, and now/needed.
Mm-hmm.
So you want to discover what are the benefits of the PAP, what are the risks of the PAP procedure, are there alternatives to this procedure, and then intuitively, what are you feeling about that information? Matters quite a bit.
Mm-hmm.
And then is it needed? Does it have to happen now? Those are all things that should be provided to you by your care provider without having to be provoked for that information.
Mm-hmm.
Any single procedure that happens in or around your body, you should be given informed consent on.
Yeah, and not in a way that pushes you into a certain decision or makes you feel coerced or makes you feel bad if you make an alternative decision, for sure.
What does the PAP test for specifically?
So basically, the idea is that we're checking for precancerous cells, changes to the cervical cells that could result either from cancer or point towards potential cancer. HPV is pretty much the big one that we're looking for, that people are, at least like gets the most play of what exactly like could be found in there, as well as other kinds of inflammation. Not every single infection will show up on it, but many of them can also.
Yeah,
So
absolutely.
it's basically just checking on like the health of your.
Yes, and there's two main types of testing that go on in a PAP, and there's a couple different ways of arriving to what should be done for certain women, and we'll share parameters for that. But for your own education, there is cytology, which checks on the health of the cells that are on your cervix. And so that comes in a grade of low to high risk and everything in between. And then a second test tests for the presence of HPV. So that will come back as positive or negative and can also have options for reflexing for what type of HPV it is, because there's certain strains that are more prevalent, higher risk, bigger issues for potential future cancer. And so looking at the cellular change is one indicator, but all of the cellular change that we are interested in is going to be because HPV is present. And so we can have cellular change without HPV, and we can have HPV without cellular change, but 99.7%, so basically 100% of cervical cancers are caused by HPV.
Which is so helpful to put in your back pocket of information and awareness.
Yes. There are 100 types of HPV.
And that's not being like, there's 100. That's like an actual statistic, like 100 different types of it.
Yes.
Yeah.
And HPV is a sexually transmitted infection. And I feel like there's an element of that is common knowledge, but there is not an element of that is emphasized, that you get HPV from your lifestyle choices.
Yes. Or I guess your
partner's lifestyle choices, right? So you have control over your cervical cancer risk to some degree.
Yeah.
Or you have the ability to collect information to assess your risk.
Yes.
And so I think that when we tell an entire population of women, this is regular screening that is absolutely mandatory, this is the only way to detect precancerous or cancerous action happening in and around your cervix. However, we're missing out on this information that it's a sexually transmitted disease that causes 99.7% of these cancers. There's not a lot of information being shared in that. Now, obviously, we can make the delineation that cervical cancer is preventable.
Right. Yes.
Yes.
Yeah, absolutely. And that you then have the assessment, your own ability to assess what potentially your risk factors actually like, right? So helpful to kind of put that in perspective and have an awareness of that, because usually as we're explaining that to people, that sort of blows their mind, right? So 80% of women, there's HPV, not 80%, like when we do our PAPs, it's not like 80% of them come back with HPV, but it's present in about 80% of women. 80% of women deal with that. Most of them are fighting off, like statistically fighting off an infection without really even knowing it, which is kind of mind blowing and pretty cool to witness the body trying to get rid of a thing.
Yeah, it's extremely common, but it takes a really long time for HPV to turn into dangerous cells, like 15 to 20 years. So that's the concept of catching it early and being aware of it. And obviously, just because you have HPV doesn't mean it's going to turn into dangerous cells, but it does give us some information to continue to monitor. So I think that's why it ends up being kind of confusing for women, because they don't know what's being monitored. Anything that comes back besides all clear can feel really terrifying and uncertain. Yeah, cervical cancer is a really aggressive form of cancer, and those of us who know women who have had to fight it or it was the cause of their death, it is a really awful thing to have to imagine, for yourself. So of course you want to have information about those types of procedures and what your own personal risk is.
Yeah, absolutely. And there's going to be some situations where things are, like, as we're talking about risk, some things that are going to be higher risk in terms of lifestyle stuff. If you are a smoker, have a history of smoking, hormonal birth control actually puts you at a higher risk. Like Tiffany was talking about, just a history potentially in a history in your family, right, of cervical cancer, a weakened immune system, history of certain sexually transmitted infections, which is interesting as we talk about nutrition, but a diet low in phytonutrients in particular. So as we talk later, we focus a lot for women whose results come back a bit abnormally about cervical health and food and diet and lifestyle and supplements and things like that. So it's just interesting that that is definitely connected. Those who are sexually active under the age of 18, multiple sex partners throughout your life, having high risk partner, even once, right, can absolutely shift your risk for it.
Yeah. And so maybe this kind of goes without saying, but we end up serving a population of monogamous women who are married to men who have been monogamous to them. And when we explain what the procedure is for and whether or not they feel like they need it, and this can be really, really personal, right? I mean, this obviously is just, you provide the information and then everybody kind of gets to make their own decision. But clinically speaking, women who have had one sexual partner only, and that sexual partner has only had them as a sexual partner, and they both feel really secure in that, you basically have risked yourself out of this screening. There's no way that anybody has HPV, then you're 99.7% in the clear. You just don't have you don't have risk factors for screening.
And some women will still hear that and be like, well, there's a 0.3, right? And they're like, that feels enough for them to move forward. But having that information is so helpful. So if you are somebody who's had more than one sexual partner, or your one sexual partner has had more sexual partners than you, then that's something to kind of keep in mind about your own risk factors.
Absolutely. And then there's a lot of misinformation about how often women need pap smears.
When I was growing up, it was like, when I first heard about them, the assessment in my brain was, yeah, you go and you get it done once a year.
Yeah.
Just like you check the box for your, quote, annual exam.
Yeah. And some research was done on that protocol, and praises, it was recognized that that was not an indicator for long-term results, that nobody was benefiting from having PAPs that often.
Which is fascinating to me, because I'm like, that's actually really rare for the medical industry to be like, maybe we shouldn't do this as often, right? Usually it's just, at least it's like a way to make money or something, right? It's like, it's great for women that that was done, and it was really seen that actually doing it that often was not beneficial.
I bet it was surrounding the observance of compliance also. Like, oh, we're not actually getting the majority of women in once a year. So let's reassess if
Yeah.
that's actually happening or not. So a lot of women think that they're supposed to go in once a year. And you're not. You're actually your risk in your screening is associated with your age for the most part.
Yeah. Which is pretty cool to recognize. So between ages 21, which we get a lot of questions, right? My 16-year-old, when should they have their first PAP? And so we have to conversation, right? Again, but the general recommendation is that between ages 21 is when the recommendations start to 29, PAP every 3 years and getting HPV tested also as desired within. So at 21, every 3 years at that point. And then you move up. There are good things about turning 30 and being in your 30s. 30 to 59 is a PAP every 5 years with HPV testing. This is all under the assumption that your PAPs are coming back normal. If there are abnormalities, then there are some different recommendations there. 60 and above, so once you turn 60, there's actually no more indication for you to get a PAP as long as the last 3 of yours came back normal.
Yeah, so that means women who are under the age of 21, even if they are sexually active, it is not indicated to start the screening process yet.
Helpful to put that in your back pocket and just be aware of, for sure.
Yeah, absolutely. And then, ladies, it's also important that you have an understanding of what the results mean. So you don't need to know what all the possible actual results are. Even we have to look them up sometimes.
Yeah.
But what should you expect from the process of receiving your result? And if they do come back abnormal, what are some of the protocols for moving forward and continuing to monitor the abnormality?
Yeah. And that should just be given information, but you, the wise consumer that you are, will know, okay, I actually need to ask more questions about this. And then you take their recommendation of, well, here are your options. And sometimes the option is, let's just wait, right, and see what happens. It can go all the way through, okay, let's biopsy this, let's move forward with something more invasive. And then you get to go and decide what is right for you moving forward.
Yeah, and like you guys have already heard us discussing, even in this episode, the recommendations are changing. So
yes,
we don't have it figured out to an exact science. And a lot of it does have to do with your preferences and your risk status. So if you have a care provider who's like, nope, this is what we do. This is exactly what we're doing. Find somebody that you feel more comfortable with creating an individual care plan with you.
Yeah, absolutely. And always, I think everything that we end up talking about always goes back to that like informed decision making and informed consent or being informed and declining the thing, right? As you process your results, you can go back to that brain acronym too. One of the things that really came to light, I feel like more and more as we've been in the birth world, especially when I first started douling, I feel like there were a lot of things getting put out about cervical scar tissue and procedures that women have done on their cervix because of potential higher risk or just abnormal PAP results, and the issues then that brought up, not only just fertility and things, but also with birth itself. I don't know about you. Have you had to remediate scar tissue in somebody's cervix before?
Multiple times.
Yeah, I have too. And it's really fascinating. So as a mom is in labor, right, and we're trying to assess what exactly is going on, doing a vaginal or a cervical exam and kind of checking the cervix, you can actually really feel if somebody has scar tissue there, it does not want to give. And we call it a massage, right? Trying to remediate that. It doesn't feel great, but it can work wonders though. But that's a pretty big risk, right? That your doctor's probably not going to talk to you about as you're getting the thing done.
Yeah. And, even as far as like it can cause cervical insufficiency issues in pregnancy, dilation issues in labor, like Kelly was talking about. It's one of the intake questions that we have with our clients when we're taking care of a new pregnant woman. Have you had any cervical procedures done? It's something that we want on our radar so that we can just be aware that we might need to provide some assistance during labor. But the other thing that I want women to walk away with today is that having abnormal results from your PAP, depending on multiple factors, right? But you do not have to jump straight to more medicalized procedures and biopsies. You can naturally heal cervical dysplasia and HPV, and that is absolutely not being talked about in the ACOG protocol that we follow from, how gynecology goes about Pap screening and Pap result.
Yeah, which for me is so exciting. Like, it's so exciting to be like, there's another way, and it's actually like quite beneficial. Like, the results can be really incredible. And there's a bunch of different kind of like articles and protocols out there that it can just feel really empowering, right? To be like, take this into your own hands. Those screenings and all of that will always be there, right? But you have a chance to take some of this into your own hands if that is what you would prefer to do, and really do some root cause, foundational, systemic healing. It's cool.
Very exciting. It's one of the things that you guys can get a virtual consultation time with us. You can bring us abnormal Pap results and we can create a natural care plan with you for that. But I'm also going to link in the show notes one of our favorite practitioners that we follow is Kristen Hauser. She's a traditional Chinese medicine acupuncturist who focuses a lot on female health, and she's written a great article on natural healing modalities for cervical dysplasia that just will provide some context to this concept if you're like, what are you talking about?
Yeah, and I think just having the awareness that there are alternatives, both in how to go about choosing if you want to have a PAP, how to go about choosing how often, how to go about choosing what you want to do with those results, even going about like who do you want to have this experience with, right? I started out with my PAP career getting PAPs with a gynecologist who, I mean, I checked the box, but it was nowhere near, I wouldn't say it was enjoyable or helpful or meaningful or empowering or anything. It was actually, most of that was the opposite. My first PAP with a midwife, I was like, oh yeah, this is real different, right? Everything about it was just infinitely more calming, empowering, all of the things.
Yeah, I mean, we have the opportunity to focus on relationship and comfort and information and taking our time. And I mean, I hate to simplify midwifery care to just being nice and courteous, but it goes a long way.
It really does. Yeah, absolutely. Being able to actually be heard and trusted, and even just the process of like, is it okay if I start yet? Here's what you're going to be feeling. Here's that sensation that I was talking about. How are you? If you want me to stop, we can. All of the pieces of just going slowly and really putting the woman in control of the situation. I'm providing a service for her. I'm not in there doing what I want to do, right? I'm there to serve rather than check.
Yes. How would you like your cervical cells to be collected?
Yes.
Yep. Absolutely. If you guys are interested in some vaginal health content, you can find a free masterclass that we did years ago on vaginal health basics. I'm going to put the link in our show notes so that you can find it there and just enjoy additional vaginal health information.
Who doesn't enjoy that?
No one who's listening now who made it to the end of this episode can say that they would not enjoy that.
It is true. Y'all are the best. Hopefully this was helpful, encouraging, empowering, educational, and maybe a little romantic at the beginning there.
Yeah, go ahead and go replay that section later for yourself.
Get you in the mood for a PAP.
We'll catch you next week, ladies. Bye.